I'm Dr. Jeanelle de Gruchy. I'm Director of Public Health for Tameside, and I want to give you an update on COVID in Tameside. Tameside's COVID rate has reduced to 38 per 100,000 people, which is great news and shows how everyone's efforts to prevent the spread of this infection are having an effect. So I do think we've got reason to be hopeful. However, I'm afraid that COVID isn't over yet. Although our rate has gone down, it's still quite high and it's still above the national average. And now with all our shops reopening and restaurants and pubs serving outdoors, it does mean that more of us will be mixing, and therefore the risk of spreading the disease will increase. So I do think it's really important to keep up the good work and follow the rules so that we don't see any big increases in COVID again. So as we do mix more, please be sensible, be cautious, and I'm just going to run through the current rules for you. So follow the rule of 6, or only 2 households outdoors, and stay socially distanced from other groups. Please don't socialize indoors with anyone you don't live with or haven't formed a support bubble with. While the stay-at-home rule has ended, please try to continue to work from home as much as possible and where you can. And please try to minimize the number of journeys you make. It still remains really important to keep up with hand washing, wearing face coverings, and, as I say, trying to limit your contact with others and only meeting outdoors, where we do know that being in the fresh air does reduce the very real risk of still catching or spreading COVID. So unfortunately, there will still be some of you who will get COVID despite all of our efforts. Please get tested if you have symptoms such as fever, new continuous cough, or any loss or change of taste or smell. Do visit our website at www.tameside.gov.uk/coronavirus/testing for any information to help you with this. Also, now all of you Tameside residents are able to access free, regular, rapid coronavirus testing. And that's for if you don't have symptoms but want to check whether you have the infection. And also, we recommend that everyone does do this twice a week. You can order the testing kits online, or you can collect from various venues in Tameside. For details of those, again, visit our website at www.tameside.gov.uk/rapid testing. These tests are quick, they're easy, and they give you a result within half an hour. If you do get a positive test from one of the rapid lateral flow tests, then you do need to still have a PCR test to confirm that. More good news is that our COVID vaccine drive is continuing at pace with more than 112,000 first jabs and 25,000 second jabs. That's in Tameside. So that's quite a remarkable number of people having been vaccinated. In fact, all of those who are in the first phase priority groups in Tameside and Glossop. So remember, that's everyone over 50, anyone who's got a health issue that puts them more at risk, have been offered the first dose. And we've also visited all our care homes to give second doses to both the residents and staff in our care homes. So if you're in any of the groups I've just mentioned who hasn't had a vaccination, it's not too late, and you can still book an appointment at your local vaccination hub through contacting your GP, or you can go to the Etihad where you're able to get vaccinated. And to do this, you have to book via the national booking system. So we are working really hard to ensure that everyone can get vaccinated. And our first pop-up vaccine clinic held at Ashton Central Mosque was a great success, and we had hundreds attending to take up their vaccine there. So for those of you who have had your first vaccine, you should receive an invitation and reminders to attend when it's your turn for your second vaccine. Thanks to everyone's incredible efforts, our COVID rates are decreasing, and we can continue to follow the national roadmap. It's got cautious lifting of restrictions. It's really important that we do go slowly to get back to doing the things we love.